Now you can see what you can see. This is the superior surface of the dorsum of the tongue. The dorsum of the tongue has got anterior 2/3 and posterior 1/3. This anterior 2/3 is the oral part and it is the pharyngeal part, okay, of the tongue. And anterior 2/3 and posterior 1/3, it is divided by a V-shaped sulcus, which is called the sulcus terminalis. Okay, and over the tongue, over the dorsum of the tongue, you can see so many elevated parts. They are called the papillae. So some papillae are around the margins. They are bigger in size. They are called the fungiform papillae, and there are numerous thorn-like projection you can see throughout the tongue. That is the filiform papillae, and at the sulcus terminali, you can see the circumvallate papillae. So you already know about the papillae during your history class. You have been taught about the different papillae and taste parts also. Okay. So sulcus terminali is this part and V-shaped sulcus, and behind there is one opening that is called foramen cecum, and through which actually the median thyroid lobule there is a journey of the median thyroid lobule through this foramen cecum, and ultimately it settles at the level of the thyroid gland. So in front of the second, third and fourth tracheal ring, you know. So there is a communication that is called thyroglossal duct. Okay. So this is the opening, shows the journey of the median thyroid lobule, and you can see this is a epiglottis, okay, and from epiglottis to the tongue, this is called median glossoepiglottic fold, median glossoepiglottic fold, and similarly on the lateral side there is another fold in between epiglottis and the tongue, that is lateral glossoepiglottic fold, and in between we can see one depressed area that is called vallecula. Okay. This is the under surface of the tongue. One is superior surface, we have seen just now, and now this is the under surface of the tongue, and here what we can see are elevated margin, that is called frenulum lingui. On either side you can see some corrugated margin, that is called plica fimbriata, and here we can find one vein which is called the deep lingual vein, and also we can see the sublingual fold. Actually this is nothing but the duct of the submandibular gland. Okay, and here you can see the opening of the submandibular gland. Okay, the opening you can see, this is the opening of the submandibular gland over a papilla. The over a papilla means there is an elevated area where we can see the opening of the submandibular gland. So if you elevate your tongue and if you watch, you can see continuous, there is a bubble, formation of bubble. Actually it is coming out, the secretion is coming out from the submandibular gland. Okay, so this is the under surface of the tongue. So here we can see the vein, that is the deep lingual vein, frenulum lingui. Okay, this is the frenulum lingui is this one, and this is a plica fimbriata. This is the opening of the submandibular gland. Okay, you can see opening of small openings. You can see this is the opening of the sublingual glands, and I am not going into the histology. Okay, the taste bud, actually I am not going into that because taste bud that is what one sensory nerve, and also there is a supporting or sustentacular cells. Here you can see the neural cell and others are the supporting cells. Okay, there is a gastatory core. Okay, taste buds are seen in not only in the tongue, also in the soft palate, pharynx. Okay, valvular, wherever there is a chance of taste sensation, so you can find that taste buds. Now, about the muscles of the tongue, there are some muscles. Mamuni, তুমি তো একদম পেছনে ঘুরে পড়েছো। এই তুমি তো একদম পেছনে ঘুরে পড়েছো। বলো, what are the extrinsic muscles of the tongue? বলো, পেছন ঘুরে একদম ওইদিকে গল্প করছো কেন? দেখো ওইদিকে, কিছু তো যাবে। There are some muscles which actually changes the position of the tongue. They are called the extrinsic muscles. They are originating from other area but inserted within the tongue. You can see there are some muscles like palatoglossus from the palate to the tongue. You can see the styloid process of the temporal bone. So from here to the tongue, so styloglossus, palatoglossus. From the hyoid bone, it is inserted here. So this is a hypoglossus. From the genial to upper genial tubercle of the mandible. So from here you can see the fan-shaped muscle that is called genioglossus. Genioglossus, hyoglossus, styloglossus, palatoglossus, and there is another muscle that is the chondroglossus. Chondroglossus. Actually, that is a detached part of the hyoglossus. It is present on medial aspect of the hyoglossus. So these are all the extrinsic muscles of the tongue, which changes the position of the tongue. Okay, but there are some intrinsic muscles of the tongue. Intrinsic means their origin and insertion is within the tongue. So they are, we can see, one is verticalis linguae, transverse linguae. You can see these are the muscles. These are verticalis linguae, transverse linguae. Okay, and longitudinalis linguae. This is superior longitudinalis linguae. This is inferior longitudinalis linguae. This is not the intrinsic muscle. This is the extrinsic muscle from hyoid bone to the tongue. This is the hyoglossus. Okay, that is styloglossus. This is also our extrinsic muscle. So when we are cutting the muscle, we are cutting the tongue. Oh, that is the transverse section. We can see there are verticalis linguae, transverse linguae, and longitudinalis linguae. One is superior and inferior. They are the intrinsic muscles of the tongue. Okay. So what is the function of the intrinsic muscle? They are helpful for the change of shape of the tongue. Change of shape of the tongue. Okay. So these are intrinsic muscles of the tongue. Now you can see the different movements of the tongue. One is protrusion, one is elevation, one is depression. Okay, you can see this is the depression, this is elevation, this is protrusion, this is retraction. Okay, protrusion is done by, we can see this is geniohyoid muscle. It is a very important muscle. This is called safety muscle of the tongue, because if this muscle gets paralyzed, what will happen? The tongue will not protrude, rather it will retract back, and it can ultimately it can close the airway. So, from the geniohyoid and genioglossus, they are very important muscles, and this is called the safety muscle of the tongue. Okay. About the arterial supply, you know already, that is a external carotid artery. We know the common carotid, which divides into external and internal. From the external carotid artery, we know there are different branches, that is the ascending pharyngeal, one is superior thyroid. Next one is the lingual artery. The lingual artery, it is coming, there is a lingual loop which is crossed by the hypoglossal nerve from outside. Okay, and this is the hypoglossal muscle over which we can see the presence of different structure, important structure. There is a hypoglossal nerve, submandibular duct, and so many structures. So this lingual artery has got, this is part 1 within the hyoglossus, this is a part 2, and this is the part 3 of the lingual artery. Ultimately, from the dorsal branches, okay, we can get the dorsal lingual artery, and ultimately it comes out, and ultimately it is known as deep lingual artery. Now, this is about the lymphatic drainage. You can see it is widely attached to different cervical group of lymph nodes. Okay, like they are present just below the mentum, that is the submental group, and also we can get, this is the this is the deep deep cervical nodes. One is jugulodigastric, jugulo-omohyoid. Jugulo means at the junction of the internal jugular vein and the posterior belly of the digastric. Jugulo-omohyoid means internal jugular vein and the omohyoid muscle. So ultimately they are coming from different parts, from tips, from the sides, from the central part. We can see there is, from the central part, there is a decussation from on either side, and ultimately first it comes to the submandibular group of lymph nodes, or from the tip, this is a submental group of lymph nodes. From there, ultimately the draining channel is the jugulodigastric or jugulo-omohyoid group of lymph nodes from the anterior 2/3, and from the posterior 1/3, you can see there it is coming directly into the jugulodigastric, and from there ultimately the jugulo-omohyoid group of lymph nodes. So tongue is widely connected with the lymphatics. So if there is a cancer cell or malignant cell, actually if it develops within the tongue, most commonly there is the adenocarcinoma. So if it develops within the tongue, it can enter into the different cervical lymph nodes. So there is the cervical lymph adenopathies. Okay. Now about the nerve supply of the tongue. Okay, nerve supply of the tongue. You can see the nerve supply. The motor nerve is the only, that is the 12th cranial nerve, the motor supply. Okay, all the muscles of the tongue are supplied by hypoglossal nerve, except one muscle which is coming from the palate. There is a palatoglossus. We know the nerve supply of palate is through the cranial accessory, we know the cranial accessory means 11th cranial nerve. Okay. Except palatoglossus, all the muscles, the motor supply is by hypoglossal nerve. Okay. But about the sensory nerve, a sensory supply, the anterior 2/3 is supplied by actually there is two types of sensation. One is general sense and one is special sense. Special sense means the taste. General sense means touch, pressure, temperature. These are the general sense. General sense from anterior two-third is by the lingual nerve, which is nothing a branch from the mandibular division of the trigeminal nerve. That is the sensory nerve. Okay, that is the general sense. But the special sense, it is by the cauda tympani nerve. It is the branch is coming from the seventh cranial nerve. You can see this is the cauda tympani nerve that is coming from the seventh cranial nerve. Okay, but the posterior one-third, that is the both general and special, they are carried out by the ninth cranial nerve, that is glossopharyngeal. So the anterior two-thirds of the tongue, the general sense is by the lingual nerve, that is the mandibular division of the trigeminal, general sense. Special sense is by the cauda tympani nerve. Okay, that is the seventh cranial nerve. It is coming from the seventh cranial nerve. That is a special sense. From the posterior one-third, both the general and special sense by the glossopharyngeal nerve. And extreme posterior part of the tongue, and from the vallecula through the 10th cranial nerve, that is, already know that is the vagus nerve, that is internal laryngeal nerve, which also supplies the larynx above the vocal fold. Okay, so extreme posterior part of the tongue, actually, if you know the development of the tongue, you will understand why I am saying that part is supplied by internal laryngeal nerve. The piriform fossa, vallecula, posterior part, extreme posterior part of the tongue, and larynx up to the above the vocal fold. It is the domain or territory of the internal laryngeal nerve. It is nothing but the branch from the superior laryngeal nerve, that is coming from the vagus nerve. Okay, pharyngeal branch of the vagus. That is, you can see, that is the 10th cranial nerve. I am not going into the, now about the development, already you know there are two lingual swelling and tubercular impart. Actually, this is the anterior two-third. Okay, and it's coming from the first branchial arch. Okay, so nerve supply is lingual. Okay, so anterior two-third is from the, and from the posterior one-third, we can see there is hypobranchial eminence. Okay, so that is contributed by second, third, and part of the fourth branchial arch elements. Okay, so ultimately, among which the third one is the most prominent. So that is the third. Is supplied by the glossopharyngeal nerve, third branchial arch. Okay, the nerve of the third branchial arch is the glossopharyngeal nerve. Nerve of the first branchial arch, mandibular division. Second by the seventh. Third by the glossopharyngeal. Okay. By the larynx. Okay. What I am uttering, just because of the fact I have got that proper larynx. Okay. So somebody sings nicely. Actually, he or she can use the larynx nicely. Okay, so that is the voice box. So what is the position? You can see from the third, fourth, fifth, and sixth cervical vertebra, and you can see there are so many cartilages, and you can see this is a hyoid bone, and behind the hyoid bone you can see the projection of the epiglottis. It is also a cartilage, and also the thyroid cartilage. You can see the cricoid cartilage. So these are the different cartilages of the larynx. Okay, there are some cartilages. You can see this you can feel that is the thyroid cartilage. Then just below you can see the cricoid cartilage. thyroid cartilage, cricoid cartilage, epiglottis. These are forming the, you can see, this is the thyroid cartilage, this is the cricoid cartilage, okay, and here you can see this is the hyoid bone. So connection between the hyoid bone and the thyroid membrane, and there is a medially you can see there is one thickened area that is called median thyroid ligament and lateral thyroid ligament. This is also called the conus elasticus. Okay. Now you can see there are so many unpaired cartilage, and in some, I will show you another picture where you can see other cartilage. This is another cartilage which is forming the skeleton of the larynx, that is the epiglottis. Epiglottis, that is also a cartilage, except epiglottis all are hyaline cartilages. Epiglottis is the fibrocartilage. Okay. Now we can see epiglottis, we can see the thyroid cartilage, you can see the cricoid cartilage. It is the posterior view, and you can see over the cricoid cartilage we can see another two cartilages. They are called the arytenoid cartilages, and within above the arytenoid you can see corniculate and cuneiform cartilages. So this is the thyroid cartilage, this is the cricoid cartilage, okay, and from here you can see the epiglottis. It is actually attached to the thyroid cartilage, okay, through a ligament which is called thyroepiglottic membrane. So this is the cut section of the larynx. Here you can see the epiglottis. There is a connection between the epiglottis and the thyroid cartilage. That is the thyroepiglottic ligament, and there is one muscle, thyroepiglottic muscle. So this is thyroid cartilage, below which we can see the cricoid cartilage, and over which we can see a arytenoid cartilage which has got one anterior part which is called the, and there is one lateral part projection and one is apical part. So it looks like a pyramid. This arytenoid cartilage looks like a pyramid. So this in front, this is called vocal process, this is the muscular process, you will know gradually. Now this is the arytenoid cartilage over which we can get corniculate and cuneiform cartilages. From within outside of the larynx, what we can find? We can find a mucous membrane of the larynx, then submucous area, then muscles. Gradually from inside outside we can get, then most outside we can get the skeleton part. Okay. So if we think about the mucous membrane, just below the mucous membrane we can find submucous layer, and here the submucous layer we can see a quadrangular shaped one membrane, okay, that is the quadrate membrane, and below you can see another membrane, okay, just here, that is the conus elasticus. We can see this is called the conus elasticus, and there is, you can see this is the cuneiform arytenoid cartilage. From here there are two ligaments are attached from the vocal process of the arytenoid cartilage. Two ligaments we can see, one is above, one is below, and they are directed towards the thyroid cartilage. So the ligament which is above, which is called the vestibular ligament, the ligament which is below, which is called the vocal ligament. Okay. So the part above the vocal ligament, this submucous layer, that is we can get the submucous, within the submucous layer we can get the quadrangular membrane, and below the vocal ligament we can get another submucous layer which is called conus elasticus. Okay. And below we are getting the, this is the area, this is the cricoid cartilage. This is a very good picture where we can see all the skeletons of the larynx. In front, this is the in front, and laterally we can find the thyroid cartilage. Above we can get the epiglottis, and there is thyroid epiglottic membrane. That is a ligament. Okay, and below we are getting the cricoid cartilage. Above the cricoid cartilage, we are getting pyramidal shaped arytenoid cartilage. This is the most important. That is the vocal process. From here, two ligaments, the vestibular ligament and another, that is the vocal ligament, cricovocal ligament. This is the cricovocal membrane. This is the cricovocal membrane. Just opposite. Okay, this should be the cricovocal membrane. Cricovocal membrane is here, and vocal ligament is not this one. This is the vocal ligament. Okay, there is a marking mistake. Okay, this is the vocal ligament. This is the vestibular ligament, and this is the cricoid to vocal membrane. This is the cricovocal membrane, and this is the quadrangular or quadrate membrane. Okay, this is a submucous layer. And beyond submucous layer, what we can see, the muscles. Muscles, they are, you can see, there are some intrinsic muscles of the larynx. We can find this is the in between two arytenoid cartilage. This is arytenoid cartilage. This is arytenoid cartilage. Below is this is the cricoid cartilage. So in between two arytenoid cartilage, one muscle is there, that is called transverse arytenoid, and one is obliquely oriented from the muscular process to the apex of the other arytenoid cartilage, that is the oblique arytenoid. Transverse arytenoid, this is the oblique arytenoid. This oblique arytenoid is continued above to the epiglottis, and it is known as epiglotticus muscle. So transverse arytenoid, oblique arytenoid, and epiglotticus muscle. And from here you can see this is the muscular process of the arytenoid. You can see one muscle is attached from the muscular process to the cricoid cartilage. So the name of the muscle should be cricoarytenoid, and it is present behind, so it is called posterior cricoarytenoid. From here, from the muscular process of the arytenoid, another muscle is coming to the arytenoid cartilage, that is called lateral cricoarytenoid muscles. Mucous membrane, submucous layer, then we are getting the muscles. Okay, from inside, outside of the larynx. Okay, so we can find the different muscles, intrinsic muscles. And another muscle, we can see this is the epiglotticus. This is the actually the epiglotticus muscle. From here, from the arytenoid cartilage to the epiglottis. From the arytenoid cartilage to the epiglottis. And another muscle which is from the thyroid cartilage to the epiglottis. It is called thyroid epiglotticus muscle. Okay. And from the arytenoid cartilage to the thyroid cartilage, thyroarytenoid cartilages. So there are so many muscles: transverse arytenoid, oblique arytenoid, then that is continued as epiglotticus muscle, and there is a connection between the thyroid cartilage and the epiglottis, that is the thyroepiglotticus muscle. the connection between arytenoid cartilage with the thyroid cartilage, the thyroarytenoid cartilage, and along the vocal ligament, another muscle which is very essential muscle for the singers, that is vocalis muscle, actually which changes the tension of the vocal ligament, and we can expect different quality of sound. So that is that muscle is called vocalis muscle. So by optimum use of this vocalis muscle, the singers can do anything. They can do wonder. Okay. So these are the muscles of the larynx. Now within the larynx, this is the, we can see the thyroid cartilage. This is the arytenoid cartilage. From thyroid cartilage to arytenoid, we can see this is the vocal cord or vocal ligament. Okay, and this is the area. This is called the Rima glottidis. That is the entrance into the larynx. Okay, this is the entry point of the larynx. Okay, so here we can see when air is coming out, it acts as a string. You have seen the string of a guitar. Okay, so this vocal ligament is nothing but it acts as a string. What we are uttering, actually the air is coming out when we speak during inspiration or expiration. Try to speak during inspiration. So it is impossible. So during expiration, we can speak. How? Because the air which has entered during inspiration, we can expire it. So during expiration, we can vibrate this vocal ligament, okay, or vocal cord. Okay. So this shape is this is called this is the entry of the vocal cord and the arytenoid cartilage. This is as a whole, it is called the Rima glottis. Okay. Now, what is the position of the, and here you can see the movement of the arytenoid cartilage. It has gone outside. You can see both the arytenoid cartilage are being, they are outside. So that is called abduction. Again you can see both the arytenoid cartilages are coming close to each other. This is called adduction. Okay. This is adduction. Okay. So normally you can see this is a triangular shaped, or you can see this is the diamond shape of the Rima glottis. Okay. During you can see this is the vocal ligament, this is the arytenoid cartilage. So it looks like a diamond. Okay, diamond shaped area. Okay. So there are some muscles which cause, you can see there are 3 or 4 muscles. They are causing adduction of the arytenoid cartilage. Only one muscle from back, that is the posterior cricoid, that is causing abduction. So there is abduction, adduction, tension and relaxation of the vocal cords. So there are some muscles, they are causing either abduction or adduction, okay, tension and relaxation of the cords. So all the muscles except the posterior cricoid, they are adductor. Adductor. Very good, adductor. Then why this abduction is needed? If there is no abduction, the two arytenoid cartilage will come absolutely close, absolutely close to each other, and there will be diminution of this area. Okay, diminution of the area in between the vocal cords. The vocal cord will get opposed with each other. What will be the effect? No air can come out or no air can enter inside. So there will be choking, breathing problem. So this posterior cricoarytenoid, which is the only abductor, which is the safety muscle of the larynx, like safety muscle of the tongue, genioglossus, that is the posterior cricoarytenoid, which is the only abductor. Abduction is needed, otherwise we will not breathe. Okay, there will be a choking. So this is the Rima glottis shape. So this is anterior 2/3. This is by the vocal cord, posterior 1/3 by the cartilage. So this is the cartilaginous part, and this is the membranous part of the Rima glottidis. Now about the movements. These are the different movements. One is towards the midline, adduction, away from the midline, abduction. When the muscles of the larynx get paralyzed, ultimately there is a position of the Rima glottis here. That is called the cadaveric position of the Rima glottis. Rima glottis is contributed by vocal cord and the arytenoid cartilage. Okay, so that is the cadaveric position. Okay, this is the abducted position, this is the adducted position. Now, if you see the cut section of the larynx, you can see the epiglottis, you can see the area below the epiglottis. This area is called the vestibule. Then we can see one sinus area, that is the sinus of the larynx, and here we can see another area that is below the Rima glottidis. Okay, that is called hypopharynx, or infraglottic compartment. So this is the vestibular compartment, infraglottic compartment, and this is the sinus of the larynx. I will show you the cut section. You will see absolutely this picture. This is the inlet of the larynx, where you can see the vestibule, and here you can see one sinus area, which is sinus of the larynx, and below is the infraglottic. And within the sinus of the larynx, you can see one saccule-like space, that is called saccule, where you can see actually it is the oil can. It is sebaceous secretions, oil can. This is saccule is nothing but the oil can, from where oil-like structure is given, so that vocal ligaments remains continuously moist. Now about the most important is the arterial supply. You know, superior and inferior laryngeal arteries. Okay, but most important is the nerve. Remember, all the nerves, the motor supply, all the nerves of the larynx are being supplied by recurrent laryngeal nerve. You have seen the recurrent laryngeal nerve that was hooking the ligamentum arteriosum, okay, in the thorax. Okay, so recurrent laryngeal nerve that is coming from the vagus, and ultimately it enters. You can see within the groove in between the esophagus and the trachea, and ultimately it enters into the larynx. So sole motor supply, okay, all the muscles of the larynx have been supplied by recurrent laryngeal nerve, except one, that is the cricothyroid muscle. Cricothyroid muscle, that is the tensor muscle. tension muscle of the vocal cord. Except cricothyroid, all the muscles have been supplied by recurrent laryngeal nerve. And about the sensory supply above the vocal fold, the vocal ligament, it is by the internal laryngeal nerve, which is a branch from the superior laryngeal nerve, which is ultimately branched from the pharyngeal branch of the vagus. That is internal laryngeal. And below the vocal fold, that vocal ligament, that is by the recurrent laryngeal nerve. Just remember that one. Okay. So normally this is the shape, the diamond shaped area. Okay. During our quiet respiration, we can see this is the shape of the Glottidis. During inspiration, we can see there is a triangular area. Okay. There is abduction. Abduction is by posterior cricoid muscle. Okay. During high speech sound, we can see they are coming in, these two arytenoids are coming close to each other and vocal ligaments are coming very close to each other. So there is a linear chink of area you can see during high pitch sound, and during whispering, kane kane kotha bola, you can see the inverted, the funnel shape, okay, inverted funnel shaped area during whispering, okay.